With garlic chives and everything?
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just
Honey?
Dad!
Tim!
need an ambulance to Seventh Floor
Tim! Tim, look at me,
don't know
Gracie.
what
Tell them to hurry. Tim, look at me, look at me, Tim.
Mom, what do I tell
I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? Yes, but he. I think he's cold. Are you cold, honey? Are you cold? Okay, Gracie. See, Gracie's gonna come, sweetheart. We're just gonna go. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? Okay. Huh? I'm right here. Gracie, meet us there. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Just breathe. Tim.
One moment I was fine. The next, my body didn't respond the way it usually does. That's what a stroke felt like for me. Sudden, confusing, and everything slowed down.
Assalamualaikum and good day everyone. Today we are sharing an awareness about stroke. What is stroke? How can we detect the signs? And what recovery usually looks like?
What exactly is a stroke? The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs, or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a clot, which blocks the blood supply, just like in a heart attack. This is why a stroke can be thought of as a brain attack. A clot may occur within the brain, or it can travel from another part of the body, commonly the blood vessels in the neck. Clots can also travel from the heart, which may happen when you have an irregular heartbeat called atrial fibrillation, or AF. If a blockage stroke is detected within the first few hours, a clot-busting medication is sometimes given to dissolve the clot. This is called thrombolysis. If thrombolysis can't be used, other medications such as aspirin will be given as treatment instead. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases.
Hi Miss Azura, how are you now?
Hi. Yes, I'm good.
Are you now fully recovered from stroke?
Yes, I am. It happened 3 years ago.
Good to hear that. During the time you were experiencing the stroke, how did it affect your emotion?
I noticed my emotions were unstable. I got frustrated easily, sometimes sad for no reason. It wasn't intentional. It was because my brain still recovering.
And what about eating?
Eating became difficult. I had to eat slower, chew carefully, and sometimes I cough while swallowing. I needed help and patience from the people around me.
That sounds really tough. How about your learning and memory? Were they affected as well?
Honestly, I had trouble focusing. I forgot things more often and my thinking felt slower. It wasn't because I didn't care. My brain just took longer.
Doctor, you know that communication also one of the impact of stroke. Many survivors struggle with speech and language. Can you explain?
Yes, aphasia is common. The person knows what they want to say, but forming a word is harder. With speech therapy and consistent practice, it will help patients to improve a lot.
Doctor, can you explain how stroke used to be diagnosed compared to now?
Sure. Previously, we mostly relied on physical signs like facial dropping, slurred speech, and weakness on one side. The two were more basic. Now, we can use MRI, CT angiography, and diffusion imaging to see exactly where the blockage and bleeding is. This helps us treat faster and plan recovery better. So actually, people can reduce their risk by monitor blood pressure, reduce salt, stop smoking, stay active, and take breaks if you sit for long hours. Small habits really help to lower stroke risk.
The effects of a stroke can be disabling, but given time, the brain can slowly adapt to recover some previously lost abilities. This is why stroke rehabilitation is so important. Rehab can be challenging, but many specialists are on hand to help alongside doctors and nurses. If your stroke causes difficulty swallowing, dietitians can recommend special diets or feeding tubes. If you have problems with communication, speech and language therapists can help. If it has become difficult to walk or perform daily tasks, physiotherapists and occupational therapists can offer exercises and home adaptations. Also, after a stroke, people often feel low or frustrated that they can't do the things they used to, and don't like being dependent on others. Counsellors can help talk through these feelings, and many patient groups are available for further support.
To conclude, a stroke may affect how someone's function, but with the right treatment and support, recovery and improvement are very possible. Life doesn't end after a stroke, it only requires adapting to new changes.
Thank you all for watching!